What is premature ejaculation and what is the cause for that?
Premature ejaculation is ejaculation that comes outside the requisite time. Requisite time ejaculation ideally should take an average of about 10 to 15 minutes. If it comes earlier, in fact, specifically if it comes less than 2 minutes, then that is preterm or premature ejaculation. Yes.
So what are the possible causes for premature ejaculation?
For most of this, and may I say from the outset that it generally afflicts very young people, a younger segment of the society, and mainly it is due to stress. It is psychological. The psychological, where it comes in is the fact that there's something they call performance anxiety. Some of them have performance anxiety, so they have anxiety. Some of them have stress related to their lifestyle. Some of them have depression, and some of them have like unorthodox socialization habits. So these are some of the things that play into the hands of this condition.
And other than saying that once an ejaculation is less than 2 minutes, then that there's a problem, what other signs? Are there some signals that, you know, I think I'm having a problem with my ejaculation?
Yeah, if he has a problem with ejaculation, first of all, he's an anxious person. And if he has a visual stimulus, for example, he tends to respond to it even in an appropriate situation, even like where the partner is not available. He would tend to respond by having immediate arousal, and that immediate arousal would end up in ejaculation that is taking a very short time.
Yeah.
So they tend to get quick arousal in inappropriate circumstances. So those are some of the earlier signs.
Yeah, and can it be addressed? Do we have a treatment for that?
Oh, indeed, indeed.
Yeah.
There are many treatment options. The first one is called psychotherapy, where sex therapists or a urologist, for that matter, can be able to assess, evaluate, get the history, and evaluate and confirm what the problem is. Then thereafter, give psychotherapy. Psychotherapy treatment options aimed at treating, taming, getting hold of the mind so that the mind can comply, can behave in a normal rather than in an abnormal way. And if that fails, there's a drug therapy that can also be used. There are certain drugs. There are substances called neurotransmitters, which facilitate transmission of impulses, nerve impulses across the nerves. So these drugs are aimed at reducing the strength or the concentration of those neurotransmitters to slow down, to curtail, to reduce the rate at which the sufferer of this condition is firing the nerve impulses and therefore leading to quick ejaculation. We often also refer these patients to a sex therapist to teach them like performance of the sexual act in different positions that can delay, for example, the onset of ejaculation. The other thing which we often prescribe that they do is to wear a device, a condom device, that reduces the sensation of the genitalia, so that ejaculation can be delayed, as it were, so that it can be achieved in a much prolonged period than the shorter period that they are accustomed to.
Yeah.